give Lacey a nice warm welcome. Come on down, Lacey. So Lacey is, well, why don't you explain what your job is, what you do, and what your day-to-day looks like.
Okay, so I'm a nurse, and I work at an outpatient clinic, so I don't work in a hospital. And I work with people usually about 55 and older. Most of them have some sort of memory loss, dementia, Alzheimer's, and what I do is I do assessments of them. So they come into the doctor's office, maybe they're not feeling well, and what I'm doing is just doing what we call a head-to-toe assessment. Looking at their eyes, their ears, their nose, their throat, listening to their heart, to their lungs, to their belly, making sure they're walking right, they're not in any pain, just kind of getting like an overall sense of like what's going on. So that's kind of what I do.
Do you look for red flags when you're doing like those assessments? So
Yes.
like an eye or ear assessment, what would be a red flag that you come across?
So maybe if they come in and I'm listening to their lungs, normally your lungs should be clear. I should be able to hear you inhale and exhale. But if I'm hearing gurgling or crackling in your lungs, that's a red flag.
So it'd be like this. Gurgling of the lungs there. Let me get some spit in my mouth. Like Darth Vader? Or no?
Not quite. More like when you're coughing and you have the stuff you're coughing up.
Okay.
That's the kind of sound you can actually hear
Like a
in your
crackle?
lungs. But I work more with actual problems of the brain, or we're going to kind of talk more about like what dementia is too.
So more, and she also said like 55 and up. So it's more people that have, their brains are starting to not work as they did when they were younger. And so they're seeing that their brains are actually starting to decrease in function. So why don't you guys actually turn to page 12, I think it is. Actually, it's going to be on 11.
Yeah.
Look at your picture of the brain. Okay, look at that. What's that frontal lobe called? What's that front part of your brain called? Aiden? The cerebrum. All right. So what we find is that, Lacey, is that true that the dementia affects the cerebrum mostly? Those functions that are like, I don't know. Let's list some. Arden, what's a couple of the functions of the cerebrum?
It's memory.
Memory. Okay. So memory loss. That obviously is the cerebrum.
Yeah.
What else? No, that's good though. Thank you for sharing that. What else? What's another function or what else does the cerebrum do? Larson?
Decisions.
Decision making. Okay. What else, Patrick? What's one other thing?
Another one is imagination, emotion, planning, and judgment.
Okay. So would you say that those are aspects that that dementia affects?
Definitely, yes.
Okay. So it's mainly those cerebral functions. All right. So on a day-to-day basis, you're doing exams, you're doing these assessments. What else are you doing on a day-to-day basis?
Drawing blood, giving shots, making sure people are safe in their homes.
Do you like shots?
I do.
Do you like getting shots?
I don't like getting them, but.
Oh, okay.
Why do you like giving them?
I actually like getting them.
Well, do you need like your flu shot, your tetanus shot, all of that you still need as you get older?
Stabbing a needle in someone.
Yeah, I just stab you on something. It's great.
But you're helping them when you do it, right?
Well, I know.
So let's continue on. And you have you're drawing blood. You're helping. Do you do like paperwork as well?
Oh yeah, lots of charting, lots of paperwork.
What does that mean that you do charting? What does that
Charting is I need to document everything I see or do. If I didn't document it, it didn't happen. So if I'm seeing somebody who is complaining about something, I need to be writing everything down and communicating that with their doctor.
So you're not their actual doctor. You're just.
I'm not the doctor. I'm just the messenger. I relay what I see with my knowledge, what I hear, and sending that information on to the doctor.
All right. So could you tell us like maybe a story or something to let us know like what is dementia? How does it affect people? What do you see when you notice that dementia is happening?
First of all, does anybody in here know somebody who has suffered dementia or is going through it? Yeah.
I have a family member that just died.
Really? Yeah. So it's really actually very prevalent. And so kind of a couple examples. So dementia can be, there's a scale, right? So some people they are driving home from the grocery store and now they can't remember where they live. They lived there their entire lives and they're driving home and now they forgot how to get there. And so maybe the police get called because they're wandering, they're lost, that kind of thing. We also have people on the other end of the spectrum who maybe now they're walking around in their nightgown outside in the middle of winter. They are not understanding that it's freezing out there, they need to be dressed appropriately. Their senses are not they're not receiving the information and processing it to let them know that there's a danger or they aren't safe with what their apparel is. So there's lots of there's a large spectrum of dementia, basically.
Yeah, Artie?
Is Alzheimer's a form of dementia?
It is, yes.
Okay. And I have a family going through dementia.
Yeah, it's difficult, huh?
So it's like what we've been talking about, especially yesterday with senses and how we interact with the world through our senses. And it's our senses that send information to our brain, and our brain it processes that information and allows the rest of our body to know what's going on. So if I come up here, I can touch this table, and I know that when I put my hand on this table, it's solid, but it's not going to burn me. Okay, because my senses are really well in tune. And if I go, and if it's a sunny day, and if I put my hand on the countertop over there, and the sun's been beating on it all day, I could put my hand on it, and I would be able to tell that it's warmer than normal, but I would be able to tell myself that, hey, that's a safe temperature. I'm not going to burn myself. So how do you see, Lacey, how do you see that effect in dementia, or people that start having dementia? What types of things happen with their senses?
Yeah, so first of all, touch. We have a lot of people who their family members have turned their stoves off because they've left their stove on with boiling water, and that can be dangerous. They've maybe unplugged their microwaves because they're putting the wrong items in a microwave. They don't know that maybe if I touch this is hot, this is alarming. As far as vision goes, maybe I shouldn't be driving because I really can't see very well. I know that's kind of looks like a stop sign, but I really don't know. So it's kind of case by case, but definitely your senses come into play with that.
And you were telling me that someone might like grab something and not notice that it's hot or something like
Yes, yeah. So,
that? Like drink something maybe?
yeah, definitely. Taste is affected. So if you have a hot pan and you know that you just boiled water, you're probably not going to touch that right away. They might go to clean up and grab that hot pot or pan and hurt themselves.
Because that sense is dulled, that they sense that they would know that it's hot, but since their brain is not connecting those thoughts, they're not able to connect the idea that when they grab it, it might be warm, but they might still grab it and be like, and it takes longer for them to realize that it's hot until they actually have pain. So their senses might be lagging or slow, they're not able to connect the dots where they maybe once were. So what do you notice, do people, how do people deal with that? Once they have these kind of slowdowns of their senses, where their senses start to becoming disconnected, how do people deal with that emotionally?
Emotionally, it's difficult. We call in family members and whoever their caregivers are. So, for example, if we have somebody who can't see very well, they've tried glasses, but they keep falling down their stairs. Something that we would do is take bright red tape and put it along their stairs, or brightly colored fluorescent tape so that they know, okay, I have a stair here, I can step down. Or nope, I actually have two more, I'm not at the bottom. Another thing that we can do is with pills. We have people, I don't know if I took my pill. I think I did. I think I dropped a couple because I can't really feel what I'm doing. So we have certain pill reminders and nurses that can come in and help them with that. So we have a lot of cool things nowadays that we can use to help these people live in their homes longer.
So the main things that it will affect are basically going to be our senses, creating thoughts, memories, and being able to access those memories. So you might know, like someone might crochet their whole lives, and then all of a sudden one day just forget to know how to crochet. Or maybe they can crochet and they still know how, but they can't hold on to that needle because they don't have the sense to be able to have the motor skills to be able to hold and grasp that needle, the crochet needle. Or being able to ride a bike. Think about how frustrating it would be if all of a sudden you just forgot how to ride a bike. Everyone says, oh, it's like riding a bike. That's like a common analogy. But imagine if you got on and you're like, oh, I need my training wheels. And you're like wobbling all over the place. that would be really, really, really frustrating. These people are 55 and older, and so imagine the frustration that they go through. It's something that is really, really tough for them. So we're going to try to simulate that. Not the frustration, but we're going to, well, probably the frustration, but we're also going to simulate what this idea is about kind of dulling our senses down a little bit, okay?
Probably annoying. You probably don't want to keep those on, right? For the whole day. So it's just kind of frustrating.
You'd probably end up getting a headache, honestly, if you wore those all day, right? Or it's like wearing someone else's glasses. These are our 4 people that are going to have dulled senses. Okay, they do not have dementia, obviously, because their brains still work. But right now what we're doing is we're simulating this idea of dulling their senses. So you each need a point of whiteboard because you're going to be drawing, we're going to play Pictionary. Okay? Alright, so you guys are going to get a picture. You have to describe the picture to your partner, but your job is to look at this picture and you have to describe the picture to your partner and have them draw it on the whiteboard as close as possible to the picture that's on this card. Alright? Yeah. And you only have 2 minutes in order to do this challenge. Okay?
Well, let's be honest, it's never quiet when you're trying to give instructions to somebody. When are you ever one-on-one in a quiet room? So maybe we could like talk and like make some noise to make it even harder for them, right? Okay, sure.
Cheer them on. And now make some good noise. Okay. You have a minute and a half. What was challenging about
My eyesight was dulled a little bit. I think it was mostly my hands, like my touch. I couldn't really draw.
The gloves were really, really slippery. When I was holding the marker, it kept on falling. So, yeah, that's
So as you push on the whiteboard with a marker to draw, was it slipping through your hand a little bit?
Yeah.
Okay. So Lacey, what do you notice in dementia patients? And how does this relate to dementia?
Yeah, so what I want to make clear is that people who have dementia don't necessarily have all their senses are dulled, okay? What is happening is that they went to grab that marker and that marker is falling out, or they're going to grab a jar of pickles and they're trying to open it, and it's too difficult. The information that they're taking from their external stimuli is going into their brain, and their brain is not able to process, oh, this is hard. The marker's falling out of my hand. They're not able to use their critical thinking to fix it. You guys were. You guys came up with other ways. You enjoyed the quiet. You were able to, you didn't get frustrated. They get frustrated because they're not able to take those frustrations of, why can't I open this? Why can't I hold this? I should be able to. The information's coming in. It's getting jumbled. And now I don't know what to do with it. So we have to come up with fancy things for them. Different ideas, different devices, that kind of thing to help them. So just because you have dementia doesn't mean your eyesight's bad, or your hearing, or your touch, or your taste. What it means is that as your dementia progresses, you're going to have a difficulty with taking that frustration and processing, what should I do next? So let's say I'm going to walk outside in my swimsuit and it's the middle of winter, okay? And I go outside because I don't know how to get dressed. I know that I need to put clothes on, but I'm not exactly sure what. So I have these clothes in front of me. I pick something and I walk outside. My feet, my everything, my senses are telling me it's cold. That's telling my brain I need more clothes, but it's being blocked because maybe I have dementia or Alzheimer's, or maybe I have a traumatic brain injury or something like that. I'm just going to keep walking because my brain is trying to tell me, but it's not able to go through.
So it's picking up senses from the outside world. It goes to the brain, but the brain is unable to put those into the correct format that you're used to. So it's still living in the world, but some frustration ends up happening because you're not able to connect the dots. So I have one last thing that we're going to try here. Each table is going to get a pair of gloves.
Oh boy.
One group is going to get a sock, or socks.
I'm supposed to catch it. Turn on the camera now. Be with them.
were to give you a starburst, I want you to predict right now, if I handed you a starburst, how many seconds do you think it would take to open that starburst? 2 seconds?
Like 5.
Maybe more? Okay, I was asking Ari. Ari says about 2 seconds, maybe a little bit more. Do you think it would take you every single time you open a starburst? Do you think it would take you more? I mean, would it take you less than 10 seconds? Do you think? Yeah. I mean, we know how to open a starburst, right? Okay. So I'm gonna give each person with gloves may only use their hands. You can only use your hands and your fingers in order to open a starburst. Okay? You only get 30 seconds. I'll start the timer. You may not have someone peel up a little edge for you. You just get the starburst, you get it. And if it is not 100% open, then I'm going to take it back. If it's not 100% open, I get it back.
Go, Ari, go, Ari.
Shred it. Shred it like a skateboard. This is really sad.
The reason that we just did this is because I know that you guys all know how to open up a starburst. And if I gave you all 30 seconds with your normal senses and your normal abilities, that you would be able to do it. And as teenagers, you guys are amazingly tenacious, meaning that you are ready to solve a problem. You are ready to go at this challenge with 100% of your brain power.
Because we want Starburst.
Because you want a starburst. There's some motivation there, right?
We want Starburst.
But
We're gonna buy Starburst.
will you raise your hand if you were unable to open up a starburst? Will you please keep your hand up? Will you keep your hand up if that was extremely frustrating to you at the end, especially because you didn't get a starburst?
I tore it at the very last 5 seconds.
So,
was about to get
you guys can put your hands down. The reason that we did this, and the reason that I took the starburst away from those people, is because it's a way to simulate how frustrating and let down somebody might feel when they know that they knew how to do something, but all of a sudden it's out of their grasp. And I know you would normally be able to have more than 30 seconds to do it, but I needed to put some type of challenge on this so that it gave you some sense of urgency in order to complete a task. So those of you that did not open up your wrapper, you guys can come grab your starburst off my desk. You guys can have your starburst.
I'm so excited.
Let's take a look at this short couple slides that I put together. And Lacey's going to jump in and add some information as well because I'm not an expert. I'm just looking at the information that I found and what I learned from Lacey. So this is a picture that was on a Harvard article. The Harvard article was, could changes in thinking skills be reversible in dementia? All right, so they're trying to figure out, can we somehow help these people that don't have these abilities to connect the thoughts in their brain? Now I want to show you why this is actually happening. So this is a good analogy of showing what's happening. That frontal lobe, the cerebrum, right? Cerebellum.
Not cerebellum.
The cerebrum is not able to function at its maximum capacity, and that's why they're showing this, is that it just slowly begins to disconnect. All right, so the cause of dementia, it involves damage of nerve cells. These nerves, these nerve cells, are being damaged in the brain, which can occur in several areas of the brain. It affects people differently, depending on the area or the part of their brain that becomes affected. Okay, so you're going to see a lot of different types of dementia. Would you say that it's not just one?
Some people, their personality, maybe they used to be really funny, like maybe your grandma used to be hilarious, and now she's kind of mean and grouchy, and you're like, oh man, what changed? Maybe that part of her brain became affected, or maybe they're looking at you and they're like, oh, I think I know who you are, but I can't remember your name, and they're trying so hard, and they just lost everyone's names, and ooh, I don't think you're my daughter, I don't think you're my son or grandson, I'm not so sure about that, you're scaring me, who are you? So we have a huge variety of different types of dementia and the way it affects your brain, and it also depends on what's causing that, because you can have vascular dementia, which is basically a loss of blood flow or damage to the vessels in that area. So if it's in the back of your head, the side of your head, it's going to affect you differently.
Okay, our cerebrum is still intact. We're still able to connect the dots. So it's like a mystery because you might look at somebody and you're noticeable physically. Can you like see that they're different? Or so you're not even seeing somebody that has like something that's changed about their body. It's in their brain that's changing. I want to show you some pictures of that. So,
and let's remember, at the very beginning stages of dementia, you know that you're losing your mind or your thoughts. You know that you're forgetful. You know that you don't remember your grocery list, but you always remember it. Like, you realize that you're kind of starting to slip. Your memory is slipping. At the end stages of dementia, you are not aware of that.
So these are some cross sections of some brains. This one is a healthy brain, and it's all the spaces in between are together. It's well formed. This is a brain of somebody that had Alzheimer's, which is a form of dementia. And you can see that these parts of their cerebrum, their frontal lobe, are disconnecting. And this is why those electrical signals that go through the nerves are not able, once they get to the brain, to then be processed correctly. Because you have these gaps there, and they're starting to become disconnected. So for those of you that don't like that picture, we're going to take a look at this. I like this picture because this is the top of your brain. And as you go down in the brain, it takes two pictures. It takes a picture here, like this, and then it takes a picture down here. So our frontal lobe actually goes across the top, and then it comes down your skull a little bit. It's like all of this frontal part and the top. So this is the part that's going to be affected. And you can see in this, you can see those gaps there in their brain. Okay, this is maybe someone who has those early signs of dementia. They know that they're forgetting stuff. They know that they always bring their grocery list to the grocery store with them, but this time they didn't. And they're like, wait, what's going on? This person is going to be someone who's maybe in the later stages of dementia, and maybe they forget what their dog's name is, but they've had their dog for 15 years. What are some ways then that how do you deal with these people that have dementia? They come to you, how are you able to care for them?
So I know that Nickel enjoys rock climbing, and I know he enjoys being outdoors, and he's athletic, and he likes to do adventurous things. So if this is my patient, and I'm like, hi, what's your name? And he's gonna tell me, or Bob, okay? And I'm like, oh, okay, hi, Bob. So I'm gonna step into his reality, okay? I'm not gonna try to force him, oh no, your name is Nickel. You're in Colorado right now. Like, if he wants to be in
Connecticut.
He's in Connecticut, and this is
Bob.
Bob.
I'm from Connecticut.
I'm like, all right,
It's so
Bob.
beautiful here.
It's wonderful. Now Bob is maybe he's getting frustrated. He's hungry, but he's not able to tell me he's hungry. Maybe he has pain somewhere and he's not able to tell me. So now he's got behaviors. He's acting out. He's throwing things around his room. He's hitting on walls. He's trying to leave the classroom. And I'm like trying to, oh, please don't leave. He doesn't care, right? So what I'm gonna do, I'm gonna introduce him, hey, let's go on a hike, or I have these ropes for rock climbing and these harnesses, and I need help putting them together. So I'm gonna bring him back into what he is familiar with, what's comfortable for him, and help engage him so that I can gain his trust, and then also keep him from wandering away or getting in trouble or hurting himself. Same thing goes, I have a lady who used to be a stay-at-home mom. She did all the chores on the farm, and she crocheted for all of her children. She frequently is leaving our building, so we have to try to get her back in. She doesn't want to come back in. This is what she's doing. So we have a huge thing of like yarn, and she's constantly sorting the yarn. She's folding napkins. We have a little garden. She's tending to the garden. So you take things that are familiar to them, that is their passion, and you kind of step into their reality. Kind of engage with them so that they can build trust, and you can kind of get them to do what you need to do. Like, oh yeah, we're gonna go to lunch now, and here's these harnesses, and here's these ropes, and here's these rock climbing books, and we're gonna try to kind of get them back into whatever we're trying to do.
Things that you're familiar with?
Yep.
So the main thing here is that like I said, you guys are teenagers. You have this really great spirit of critical thinking and problem solving. If you do know somebody that has dementia, like Lacey's saying, you have to somehow try to introduce them back into the world that they knew, but you have to start with where they're at. You can't just assume that they're going to know what your name is. You might have to just be okay with them not knowing your name, and that you're just another person out there in the world until you can maybe try to build that bridge later on. But it's really important that you greet them with kindness and caring, because they once knew this stuff, and you can tell how frustrating that would be, just like how frustrating it might have been if you really honestly couldn't open Starburst. Okay? Or if you really honestly couldn't draw the picture that you wanted because you had trouble holding on to the marker. Okay, these are things that become frustrating because they were skills that you once had. So one last thing that I wanted Lacey to share with us is what is your life story from 0 to 8th grade? Because you guys see Lacey up here as someone who's a nurse who deals with dementia patients, who is constantly helping them out on a daily basis. And I think it's really important for you guys to understand that just because she is a nurse, has it been something that you wanted to be since you were a little kid? Have you always wanted to be a nurse?
I don't think so. Wanted to be a teacher.
Oh, there you go. I stole that dream from you.
Yes, you did. All right, I'm going to do this very briefly. Okay, so I grew up on a farm in the country. I was the only girl and the youngest. I was taught that I needed to work hard, actually harder than the boys. So we had chickens, turkeys, goats, sheep, horses, cats, dogs, and it was our responsibility to do the chores. I always had more chores than the boys did too. I went to school on the school bus with my brothers. I found out very early on, probably at the end of 1st grade, that I was a terrible reader. I tried very hard, I just couldn't pick it up very well. Then in 3rd grade, I found out I was terrible at math. And then I struggled with math. It wasn't until 4th grade that I had an awesome teacher, Mr. Rocco, I'll never forget, who took the time to help the students who needed more time, those who needed to be more challenged, and he kind of broadened it so that no one felt left behind, basically. And then the summer of 6th grade, I ended up having a math tutor for a short time to help me get ready for middle school. Middle school came, and it was the first time that I had a locker, the first time I had a school schedule with changing classrooms, the first time that I got involved in school sports, the first time I experienced what cliques were and drama and new friends, making friends, keeping friends, changing friends.
On a scale from 0 to 10, how was drama in your life? 0 being it wasn't part of your life, and 10 being like it's the only thing that occupied your life.
Drama in the 8th grade or middle school is probably about 8 or 9, I'd say. It's all about.
How did that affect your classes?
It definitely affects your classes, right? If you know your best friend's mad at you, are you really focused in class? Probably not so much, because how can I write them a note and make it up to them?
Send them a snap tweet or a
Yeah.
Insta
We did have
What the heck is a snap tweet?
Yeah, we did
Anyway,
have snap
sorry.
tweets.
All right, hold on just a second. Let's let Lacey finish.
And then by middle school, it basically helped me grow into a better learner, and it pushed me to be a better student. So that was my life from 0 to 8th grade.
So you guys have the ability to also become nurses if that's what you choose. Thank you guys. Please give Lacey a thank you. Welcome. Maybe give her a high five before you leave.
Hi, Camille. Come on.